Hi, my name is Dr. David Nyberg. I'm an expert in prenatal ultrasound and prenatal testing. In a previous video, I talked about the Harmony test and how it can be so helpful for detection of Down syndrome. But in this video, I'd like to explain other tests and how that might work together. First of all, realize that the odds are that your baby is perfectly normal. And we know that's going to happen in about 97% of cases where your baby's perfectly normal. But there's a small percent, 2 to 3% chance that your baby could have a birth defect. Regardless of your age, prior history, family history, lifestyle, or any other factors. It really reflects simply the complexity of making humans. It's such a complex process, and it really happens in such a short period of time that it doesn't always happen perfectly. So even without any risk factors at all, birth defects can and do occur. Fortunately, most birth defects are relatively minor and usually will involve just one organ system, one part of the body. It could be anything. But sometimes it affects important parts of the body, like the brain or the heart. And even though it's isolated to that, will have a major effect on the baby. Other times, birth defects are relatively minor. For example, an extra digit of the hand, which can run in families. And that's not life-threatening, and it can easily be fixed. And then there's birth defects really in between those that we mentioned. And if we look at what kind of testing is available, and you might ask yourself, what's the best way to reassure ourselves that my baby is normal? Well, the best test to look at the baby from head to toe that we have available really is ultrasound. Ultrasound is the single best test, and the only test that allows us to look at the entire baby and really reassure ourselves that everything is developed normally. Now, ultrasound can be very powerful for doing that, and also very useful and very accurate for detection of major birth defects. But when it comes to certain types of birth defects, like chromosome abnormalities, that's when ultrasound could use some help. And that's where the other tests that are available come into play. One of those tests is the Harmony test, which I already mentioned. The other test, which we would recommend for patients who don't choose a Harmony test, is the first trimester combined screen, which occurs right at around 12 weeks with a range of about 11 to 13 weeks. It's a great test, very accurate for looking at the baby. I call it our first look, our first screening exam for looking at the baby. But also it's very good for looking at Down syndrome. The detection rate is about 85% for detection of Down syndrome as well. So that's a very useful ancillary test, and we would recommend that patients either have that test or the Harmony test in addition to the ultrasounds that they will have. Thank you.